Gonna record. Oh, I think we are on. Perfect. Okay. Hello, welcome folks to the cultural responsiveness learning community. Today's session is from awareness to action, responding to microaggressions with micro resistance. I'm so happy to be here today. My name is Amy Banco. I, again, am a faculty member at Rutgers University, all the way over on the East Coast in New Jersey. And I'm excited to be here with you practitioners coming in from all walks of Washington State service provision, helping you to explore and build your clinical skill sets. So thinking about today's session, just a reminder that today's webinar is hosted by DBHR through the Washington State Healthcare Authority. This is an interactive training, and we encourage you to ask questions and participate throughout the session. You'll have the chat box to do that, as well as your microphones when you are in breakout group room activities. Please note that the use of automated note-taking bots or similar tools during Washington FCS events or meetings requires prior approval. Unauthorized use of such tools is prohibited to ensure the privacy and confidentiality of all attendees. Also, any recordings that are created through AI is not recognized as an official recording of this session. And FCS Washington State reserves the right to exit trainees from the training if they're using AI to take notes without prior approval or using AI to record the session. Please note that materials from today's session and the recordings will no longer be emailed to participants. Materials will be uploaded to the chat during today's session. Additionally, the facilitator, myself, will upload the PowerPoint and the handouts towards the end of the webinar. The recording for today's session will be made available on the HCA FCS channel, which is the Foundational Community Support FCS YouTube channel, then approximately 2 weeks after today's session. And these are basically, the guidelines that I start each cultural responsiveness learning community session with. And ultimately, the guidelines are a gentle reminder that we are going to operate today's session in these next 90 minutes with respect and dignity for all of the unique and beautiful identities we bring to this virtual space. We will be discussing some sensitive topics, some personal experiences. We want to navigate those conversations with kindness and empathy, and from a perspective of listening to understand. Okay. Additionally, the Cultural Responsiveness Learning Community is offered monthly on the third Tuesday of every month from 3 to 4:30 p.m. And we focus on building and strengthening cultural responsiveness in the work that you do, looking at equity-focused practices. Past topics of this particular learning community have included practicing cultural humility, as well as broaching in mental health services. Our next session will be held on Tuesday, December 16th, again, 3 p.m. to 4:30 p.m. And the topic for next month will be creating work cultures that are attuned to mental health wellness. And we encourage you to join us each month as we learn and reflect and take action towards more culturally responsive services in Washington State. I see a whole bunch of introductions coming into the chat. It is great to see all of these amazing participants here today from so many different walks of service provision. I see supported employment, supported housing, different job titles of individuals, operations manager, case manager, Northwest Center. So many different organizations. It is great to have each and every one of you here today. Thank you so much for carving out time. Case manager for Medicaid in Kitsap. That's amazing. Oh, wow. So very diverse group here. It's great to have each and every one of you here. I know that you're so busy with your service provision, documentation, all the things that are on your plate to carve out this 90 minutes to build your skill sets is very commendable. And I appreciate your commitment to building your skills and learning, that continuous process of learning. So today, for our objectives, for our 90-minute session, we're looking to define microaggressions, stigma. We're looking to also identify micro resistance and micro interventions. We're going to look at this piece of identifying roles in these exchanges, right? From targets to allies to bystanders, in instances of microaggressions or bias. And we're going to describe some core micro interventions that will help us to make bias visible and to hopefully disarm it, right? Those are our micro resistance interventions. If there's anything you would like to add to that agenda that you're hoping to touch upon for today, go ahead and put that into the chat. Anything that you're looking to hopefully learn from today's session. I want to make sure that we are meeting your needs and the things that you're looking to really build upon as you are, again, participating in this 90-minute session. Okay. So thinking about and just getting the wheels turning on our topic, for years, social justice advocates have underscored that social responsibility of everyone to take action against prejudice and discrimination, to develop awareness, knowledge, and skills necessary to confront whether it's individuals, groups, institutions, right, that are manifesting instances of oppression, and to actively promote conditions that allow for equity and inclusion, opportunities for marginalized groups. These pieces of scholars or the work from these scholars highlight that it's not sufficient. It's no longer, it never was sufficient to simply claim that someone is neutral in the stance of oppression or non-racist. Instead, right, we're now really framing an anti-oppressive practice as ongoing, active commitments that really must be reflected in our everyday choices, relationships, work roles, institutional roles. And despite these pressing calls that we hear from scholars across all fields, right? Psychology, social work, counseling, other mental health adjacent fields, right? Just despite these calls, many have noted that there's remaining silence and inaction that often accompanies an incident or expression of bias or prejudice or discrimination in everyday lives. We see that bystanders may look away, change the subject, minimize harm, or even when they recognize, that something is wrong, there's that silence. And we're going to talk a bit about that today to explore why some of these things persist, even though there is this widespread acknowledgement that things must be different. And to get those wheels turning, to start thinking about this in that regard, I'm going to put you into your first breakout group room. This is an activity that we call the bystander moment. And the goal is to help you as participants reflect on experiences where you may have observed an interaction, right, where there was stigma or bias or a comment that was, problematic, and really reflect on that situation with your group members, right? Not necessarily what you heard or what you saw, but more about how did it make you feel and what did you do? Right, so you'll go into a breakout group room with 3 to 4 individuals, and you'll each take turns just sharing a little bit. Again, you don't have to focus on the details. I want to be very mindful that we want to be gentle in our disclosures. No names, no identifying details about people or agencies. Share what only feels safe. And to just explore how did you feel in that observation and what did you do? Any questions? I'm going to share this screen to our breakout group room so that you can see the activity. We'll have about 5 to 8 minutes for everyone to kind of take a turn, and just as you're speaking, be mindful that when we come back, we're going to talk a bit about themes, right? What came up in your groups? Were there responses that were similar? Did people share similar feelings or similar actions or inactions? Okay. Any questions? Okay, I'm going to open up those rooms. I'm going to be mindful to make sure that everyone is paired with at least one person. Sometimes we have some difficulties with that. So please be patient. If you're in a room and you're by yourself, I will get to you to make sure that you have a partner. And if you need help getting into your room, please let me know. I will assist. Okay, rooms should be open. I'll see folks back in roughly about, let's do like 8 to 10 minutes. We have some pretty large groups. Let me make sure I'm sharing screen for breakout rooms. And if anyone needs help going into that room, I am here to assist. I'm actually going to pause the recording while we are doing our activity. Of our session. Okay, I think it is recording again. Perfect. Okay, so we kind of reviewed that. Unfortunately, in this activity, we see that these things happen, right? Everyone kind of shared a bit about the experience of hearing microaggressions, bias, right? And reporting the emotions, the hesitation or second guessing, right? When we are observers, right? And what we see in literature and research is exactly what you're describing, right? These aren't just our own individual experiences and stories. They're patterns of experiences that show up time and time again in literature on stigma and microaggressions. And let's, continue to look at how scholars describe some of these same barriers and why stigma is so persistent, even when we hear a collective call to address it, right? So in the United States, we live in a context where bias, stigma, discrimination, bigotry, again, are publicly condemned, yet they remain stubbornly present in everyday life. That paradox often leads people in supported employment programs, supported housing programs, to ask, if everyone says, prejudice and bias are wrong, why does it keep showing up? Showing up in teams, in our agency, in community settings where we work. And we see, in terms of the literature, social scientists have found that silence is rarely about indifference. Instead, people often stay quiet because of 5 predictable barriers. And this is pulled right from the Sue et al. Book. I believe it's from 2019, on looking at micro interventions for addressing microaggressions. And this first barrier is modern bias can be invisible, coded as jokes, preferences, misunderstandings. Oh, that's not what they meant, especially in professional settings. Second barrier is that there's a tendency to trivialize incidents. It was just one comment, right? I don't want to make a big deal out of it, right? Or third, we experience diffusion of responsibility. My supervisor should say something, not me. Or fourth, and someone said this earlier, fear of repercussion, damaging relationships with coworkers, maybe employers that we work with job development and supported employment, or landlords that we work with in supported housing, or fear of being labeled as difficult. And then finally, many of us feel this paralysis, right? The fifth barrier of not knowing what to do or say in the moment. And these barriers show up for everyone, that we may be working with, or our coworkers and colleagues, right? And so we can take from these barriers ways, and we're going to learn these strategies today to combat some of those barriers, to mitigate or attenuate them, right? Thinking about when we think about the topic of coping, right? Um, Coping with microaggressions, with bias, and the way that microaggressions show up in the literature, the scholars really distinguish between two types of coping. One, emotional focused coping, strategies that help us to manage distress of these particular exchanges, and problem focused coping, which aims to change or challenge the source of stress. And that's really rooted in um, a social justice approach of taking action, being solution focused, and advocating for justice, equity, um, and inclusion. Both are valid responses, but when it comes to addressing, the isms, racism, sexism, ableism, right? Most of our research and training has focused on helping people to really survive the emotional toll, to manage, rather than equipping them, allies or bystanders, to actively disarm or challenge the ism, right? At maybe an interpersonal level or an institutional level. So there is this gap in our knowledge, gap in how to address these concerns. And today is really all about that second focus, problem focused coping, right? Um, Being solution focused, if you will.
Mhm.
So thinking about that, and kind of whittling down some of our terms for today, right? We want to focus first on this piece of stigma. Pat Corrigan, who is a really prominent scholar in terms of stigma and internal stigma, describes public stigma as negative attitudes and beliefs held by the public about groups that are labeled, right, as different, and that fuels prejudice, discrimination, and bias. And we know that, stigma isn't just um, a bad perception or attitude. It's a process. It's a cluster of processes, right? Labeling people as different, attaching stereotypes, kind of othering, right? Separating us from them, and then using power to produce status loss or discrimination. And that pattern can show up across many marginalized identities, including race and gender, sectional identity, disability, immigration status, socioeconomic status, religion, and more. And why does this matter for SE and supported housing, right? Because public stigma doesn't just sit in the air, it lands, right? And it lands in terms of these life domains: employment, housing, healthcare, and education, right? Studies show that stigma is a driver of not hiring people with, attached to certain marginalized identities, including people with mental health conditions. It's attached to, right? The stigma is attached to denying or restricting housing, providing poor quality healthcare, lowering expectations in the education domain. Um, we even see colleagues, scholars arguing that stigma functions as a fundamental cause of health inequity. And what do I mean by that? Um, right, there are effects of public stigma, and we can think in terms of social determinants of health. The World Health Organization, and Healthy People of 2030 tell us that health isn't influenced just by mental health services and genetics. It's produced by conditions of daily living, right, of life. And that can be influenced by things like income, education, safe housing, this piece of discrimination, social inclusion. And so public stigma operates kind of right inside those determinants. Again, it shapes, who gets hired, who gets housed, how people are treated in healthcare and education, and whether they feel safe accessing services at all. We know that public stigma has clear mental health effects across multiple marginalized groups, right? People with disabilities, people, within the LGBTQIA plus communities, people of color, right? That stigma is associated with higher rates of mental health symptoms, depression, anxiety, stress, lower self-esteem, even lower hope, right? When people are repeatedly treated as less than. the message inevitably kind of like seeps in. We also see that public stigma changes how people use services, right? We know that stigma can lead to delay in health-seeking behavior. It can impact how people attend services, or if they even drop out earlier, right? And that's because of past experiences of being mistreated, of experiencing microaggressions, of having to manage, right? The heaviness, the continuous toll of experiencing marginalization or oppression or bias, right? And stigma has social and economic effects. Corrigan and colleagues documented how public stigma can reduce access to competitive employment or independent housing, right? And we know that stigma is a fundamental cause overall of these health inequalities. In your SE and SH settings, where do you see effects of public stigma on participants, job seekers, or tenants right now? You could put in the chat. Where do you see some of the effects of public stigma? You could put it in the chat. Anything come up where you see hospital care? Yes. They don't want to oh, it's going so fast. They don't want to participate. Yes, yes, Chloe, the fear of rejection. And so they may disengage, drop out, getting jobs when they can't shower, they don't have an address, right? So that stigma and discrimination. Yeah, schools, federal policies. Oh, that's a biggie, Audrey. Yeah, those are macroaggressions when we see that seeping into policy, institutions, things of that nature. NIMBYism. Yes, Mike. Right, the not in my backyard. Absolutely. Um, much lower motivation and engagement. Yeah, yes, especially fear of safety. Yes, fear of safety right now. Who's going to be the next minority who ICE can just, yes, yes,
Mm-hmm.
Fernandez. That is a um, very, very real concern for many individuals across the country tonight who are experiencing that oppression, marginalization um, from our government. Um, Death rates for BIPOC women and non-BIPOC populations. Yes, the disparities for individuals receiving health and healthcare services, medical services, lack thereof, misdiagnoses, or mismanagement of treatment. Rebecca, right? We see that a lot for individuals who are in BIPOC communities. Yeah. So we see a lot. We see a lot in terms of the effects of public stigma and how it is a driving force in healthcare disparities, outcomes across these social determinants of health. So this topic is really critical. And then self-stigma, right? When we think about this concept of public stigma, self-stigma is when that message starts to live inside people. Scholars like Pat Corrigan often call this internalized stigma the extent to which a stigmatized person endorses and applies society's negative stereotypes themselves instead of just hearing, people like them are X, Y, or Z. The person starts to think, well, that has to be true about me because I belong to that group. And this process has been well documented across many marginalized groups, right? From people who have disabilities to people who are in LGBTQIA plus community, people of color, immigrants, people with larger bodies, people who are multilingual, right, can experience some of that internalization of stigma, and that becomes very dangerous because then we may start to see the why try effect, right? Where people begin to feel like they are less worthy, less capable. They may, ask themselves in relationship to the work that we do, like, what's the point of trying to get a job? Or what's the point of trying to, get my independent housing situated? So we see internalized stigma is linked to, again, reduced help seeking and reduced engagement in care. Someone put in the chat before, it can decrease motivation. That's what's coming up here, right? Decrease motivation and commitment to change behaviors because a person is feeling ultimately hopeless, right? They're feeling hopeless. And that's due to that public stigma. So stigma is made up, again, of widely shared stereotypes and status hierarchies, um, right, that get attached to marginalized identities. When we think about microaggressions, those are the scripts people use in how they transmit, convey, right, communicate stigma, right? Stigma um, ultimately provides the content, and microaggressions are the delivery system. Um, this term microaggression was first coined in the 1970s as a way to really describe subtle insults, put downs, specific to people of color, individuals who identify as Black or African American. In present day, people can direct microaggressions towards any marginalized group, right? This kind of area, this work is expanding now to all marginalized groups, right? And a marginalized group, again, is a group that is outside of the dominant culture, right? They are outside of the dominant group. And so that could be due to race, again, gender, religion, right? All of those different cultural facets. And when we talk about microaggressions in the training, we're not only talking about, again, race, though racial microaggressions are most extensively studied. We're also, again, talking about patterns of everyday bias directed at any marginalized group. Sue and colleagues, and I pulled a lot from Sue for this training. I really appreciate their work and the body of work that they've done on this particular topic. Define microaggressions as brief, uncommonplace, daily, verbal, behavioral, or environmental indignities, whether intentional or unintentional, that communicate hostile, derogatory, negative slights, insults towards individuals because of their marginalized group member, right, or their group membership. Um, so when we think about, microaggressions, they can occur between staff and participants, between participants in our programs and employers or landlords within teams, right? They can occur at a multitude of levels. And it can be challenging, right? In determining what do I do, right? What do I do with this potentially unintentional act that is communicating the evaluation of a marginalized individual or identity, right? And that can undermine, again, safety and trust on engagement for participants. So we have to kind of really think about, right? How do we proceed? First part of kind of knowing how to move forward is to get a good understanding of what microaggressions look like. And there are three types defined by Sue and colleagues. First is microassaults. Microassaults is probably the easiest to recognize. Sue and colleagues define microassaults as explicit, derogatory, verbal, nonverbal, environmental exchanges aimed at hurting or excluding members of marginalized groups. Unlike more subtle forms of microaggressions, microassaults are typically conscious, deliberate, even if the person later kind of tries to minimize them as like, oh, that was just a joke, right? That was just a joke. While the original work of Sue et al. Focused on racism, we see microassaults across many identities, right? And these are not misunderstandings. They are direct expressions of bias towards, again, people based on any cultural identity, right? Especially marginalized cultural identities. Research on hate speech and blatant discrimination shows that these events can trigger distress, trauma responses, mistrust of systems, Again, impact on that help-seeking behavior with providers. And so micro assaults can convince participants in our services that maybe staff in our programs, landlords, employers cannot be trusted. It may impact people, in terms of rejecting opportunities, like someone said in the comments earlier, or create a workplace, culture for staff where people may feel like they're devalued or just under threat when hearing these particular comments. Verbal microassaults might look like making derogatory remarks, using offensive language towards individuals. Nonverbal microassaults could be, avoiding eye contact or physical proximity with an individual due to their identity, right? A piece of that cultural identity. An environmental microassault might look like creating a workplace that reinforces negative stereotypes, um, in terms of a cultural identity. The third, excuse me, the second microaggression is micro insults. And these are a little more complicated to identify because they often sound neutral or even, may seem nice or polite on the surface, but there's an underlying message. And that message is demeaning and devaluing. Sue and colleagues describe micro insults as communication that convey rudeness and insensitivity, right? Um, really, comments that are demeaning towards a person's identity or heritage, right? And the key is that the speaker may genuinely believe that they're being supportive or complimentary, but the harm is present, right? And so, that might look like, comments about someone who speaks English with an accent. Wow, your English is really good, right? That is a micro insult, implying that someone is surprised, right? That, they could be fluent in English, right? That is a micro insult. Research on micro insults related to race, gender, affectional identity, people of color, disability show that these patterns are again linked to increased stress, symptoms of anxiety or depression, a decreased sense of belonging, right? Because what these insults do, these micro insults do, is chip away at a person's sense of worth and value. People often report that the ambiguity makes it even worse. If they bring it up, they're being told they're reading into it or they're being too sensitive, um, right? And so, really, when we think about micro insults, they're sudden, often like polite messages that question competence, worth of a marginalized individual. Recognizing that hidden message behind these comments is very key into our first piece of micro resistance, knowing what the hidden is, what is being implied here, and then we can begin our micro resistance responses. And the last particular microaggression is micro invalidations. And these are communications that exclude, negate, or nullify right, the experiential reality of people from marginalized groups. These often come from people who think they're, again, being fair or objective, but the effect is to erase identity-based experiences. And so these might be like, I don't see color or gender or disability, I just see people. Um, right? It's like this like aim like of intending to be inclusive when they're actually erasing the very real differences in how people experience the world, right? And are treated based on identity. Um, Another comment that might be a micro invalidation is, oh, you're overreacting. It wasn't about X, Y, or Z. Everyone has trouble with housing, or everyone has difficulty, trying to find a job, right? Those are examples of some micro invalidations. Again, when we look at research into this form of microaggression, we can see that invalidating experiences of discrimination is linked to greater distress, internalized oppression, and again, diminished help-seeking behaviors. And so we have to be very mindful of, again, that first step of knowing how to identify this, right? Um, Knowing how to spot these invalidations, because ultimately these responses shut down important information about safety and access and equity. They also make it harder for participants and staff to trust that the program will truly advocate for them. And micro resistance, in contrast to this, is kind of like leaning in, listening, validating, exploring what support is needed, right? Um, so thinking about these three forms of microaggressions, what we know is that they are subtle assaults. Any of the three are subtle assaults on someone's identity. That small everyday comments, behaviors, um, can really ultimately communicate something about person and who they are, their identity, right, as being less than or out of place, um, right? And so when we think about that, um, again, what comes to mind is that internalized stigma that these particular pieces of communication, especially as they continue to scaffold one on top of the other and continue, can impact a person in terms of how they view themselves, how they define themselves, and how they connect with mental health services. So thinking about that, I'm going to put you back into your breakout group rooms, and I'd like you to think about a time that someone said something about some aspect of your identity that you felt was intentionally or unintentionally dismissive, insulting, or demeaning. To your level of comfort, please share with your um, virtual colleagues, how did it make you feel? How did you respond? And how did you feel afterwards, after the moment, right? Again, I just want to be very mindful as we are sharing. Choose what you want to share. Don't feel pressure to share a very emotional experience. You can choose something that feels a little bit safer to talk about in our virtual training space. You don't have to share all the details about what was said. We're just focusing on the impact, right? The impact of um, experiencing, right, a microaggression as a target. First, we looked at our first activity as a bystander, and now we're looking from the view of being that target. Any questions? Oh, I see some things in the chat. Gaslighting, yes, yes. Microaggressions often have that air of gaslighting, especially those micro invalidations, right? That's not what happened. You're misinterpreting. Yeah, yep. Okay. Any questions? I'm going to share the screen and we'll do like another 8 minutes.
Ooh,
Hopefully everyone will have some time.
dismissive.
Yeah. I know. I just needed someone to recognize it.
Hello? I'm sorry, I didn't hear you. Did you want to share? Oh, okay. I'm going to put you guys in your rooms. I'll share this to your screen and I'll see you back in about like 8 minutes. Let me know if you have any difficulty getting into your room. I'm here to help. For people that are not assigned, I am working on getting you to a room now. If you are in a room by yourself, please hang tight. I will try to make sure that everyone has a partner. Let's see, how are we doing with that? I'm going to pause the recording for the second activity. Where's the recording? Okay, I think we're good. From a bystander perspective, but also from a target perspective, as these experiences are scaffolded, right, they can start to impact a person's well-being and can be trauma inducing, right? These are potentially small T traumas, or can even serve in some instances and escalate to big T traumas, right? These are adverse events of microaggressions that erode a person's mental health, their sense of safety, right? And that's where trauma comes in, right? When someone's safety is compromised, where their stability is compromised, whether that's physically or emotionally. And so we just want to be mindful that the impact of these experiences can be long lasting, can show up in different ways. And when we look at the current literature about trauma, like in terms of racial trauma, in terms of all of the trauma research that's being done in relationship to discrimination, interpersonal discrimination, systemic discrimination, that cumulative impact that we're seeing, especially people who have like intersectionalities of identities. We see that the impact is present, that it does result in trauma responses. And there's even research indicating that this trauma can be passed on in future generations through DNA. That's wow. Wow. So this is really important work for us to focus on. And the next step in this is breaking down who acts, right? Let's move into now our approaches. Who acts, right? Well, that can be, according to Sue and colleagues, targets, allies, and bystanders. Targets are individuals directly impacted by the microaggression. Allies are people with relative power privilege who want to act and choose to act. And bystanders are witnesses of the interaction and may or may not act. Roles are not fluid, not fixed identities. All three groups can use micro-resistance strategies. And what are So again, I discussed targets. Sue identifies targets as people who were the recipient of that microaggression, that prejudice or discrimination. And again, we see this across all marginalized cultures and groups, can be targets. Then we see allies, individuals who may belong to dominant social groups. This can include white people, men, cisgender people, non-disabled people, individuals who have citizenship, individuals of higher socioeconomic status, who are actively working to support marginalized groups, communities, and challenge systems of oppression. And then the bystander group, again, could be anyone. Could be staff, supervisors, landlords, employers, neighbors, even other participants who witness or become aware of unjust behavior or those microaggressions. And so I'm going to put into the chat our focus for our next 15 minutes. Oh, can I put into the chat? Okay. A handout that goes over our micro resistance or micro interventions, and what group can use them, right? Whether it's target, ally, or bystander. And thinking about the interventions, again, micro resistance refers to small everyday acts that people use to resist oppression, bias, and microaggression. And when we think about Sue and colleagues, they define those micro interventions again as any actions that we can take that are anti-bias, words, deeds, that can help people, right, to counteract, challenge, diminish, or neutralize expressions of prejudice, bigotry, discrimination. Right, this is how we respond to microaggressions. And Sue and colleagues in their book identify 4 core strategic goals of micro interventions or micro resistance, which one is make the invisible visible. And that can be used for all 3 groups: target, ally, as well as bystander. Disarm the microaggression. Those tactics can be used again for the target, for the bystander and ally, as well as the third core strategic goal, educate the perpetrator, which is often not something that would fall under the realm of the target. Individuals who are being targeted can engage in educating the perpetrator, but it shouldn't fall on the individual who is being marginalized, oppressed, or attacked with a microaggression to educate that perpetrator, right? Hopefully that can be intervened with an ally or bystander, as well as the fourth strategic goal, which is seek external intervention and support. The rest of the session for today focuses on two core strategic goals, the total of 15 strategies or tactics. The first strategic goal, make the invisible visible. Right. So how do we respond? What do we do if we hear those comments? Think back to our activities that you talked about as being a bystander and as being a target. Right. We can start with the goal of making the invisible visible, exposing and naming the bias in the interaction. And why do we do this? To validate the identity and the person's lived experience, to reduce that sense of hopelessness or paralysis that a person may experience when they are on the receiving or observing end of a microaggression, and to challenge or to interrupt, right, bias and the structures that perpetuate bias. So what are the tactics for this? The first, right, is seeing clearly what is actually occurring. Sue and colleagues call this per perspect I always get this wrong, perspicity, right? The ability to see beyond the interaction, read between the lines, to look for the meta communication, right? This is tactic one. Most microaggressions are not explicit slurs. They come as like those compliments, those jokes. I'm just being honest. How we've always done things, like someone was saying earlier about experiencing microaggressions. And so what's the hidden message? That's tactic one. Who is being positioned as less capable, less trustworthy, less deserving? And so we really need to look at what is being implied here. And then tactic two is really, and this I think goes hand in hand with step one, is to name it, to naming and demystifying and destabilizing, what is being said, expressed or conveyed, right? And so that might look like, the comment that you just said plays into a negative stereotype about XYZ people, right? That sounds like a microaggression about gender, about race. So one is identifying it internally, knowing what's happening, and two is saying it out loud, right? Naming what the person's doing, right? In just a very factual manner, right? And so these first two tactics are about shifting from confusion and doubt to clarity and shared language, right? Tactics 3 and 4 are to undermine the meta communication, right? Once we can see and name the bias, we can choose how we want to respond. And tactic 3 is, again, undermining that meta communication. So it's really about acknowledging what the person is saying and subtly exposing false assumptions, right? So an example, you're really impressive for someone like you. You're really impressive for someone like you. And undermining that meta communication, that micro resistance tactic 3 would look like, I appreciate that compliment. I'm really proud of my skills. And you know what? Having a disability doesn't mean I'm less capable, right? So going below that surface to addressing the hidden belief that is being expressed and challenging it, right? Challenging the meta statement, the meta communication, if you will. And then tactic 4 is more direct in challenging the stereotype, right? Really calling calling out what the person is saying. And so this tactic can be more confrontational. Sometimes it can evoke more defensiveness. The goal isn't necessarily to like win an argument in that moment. It's to plant a seed, to protect a person's dignity, their identity, to signal that the stereotype is not shared or accepted. And so an example of that might be, needing an interpreter doesn't make someone less intelligent, right? Having a mental health condition doesn't mean someone isn't reliable at work. It's really challenging the stereotype quite directly, conveying in a very direct manner a contradiction to what they're implying or what the person is stating. And then tactics 5 and 6 include to broaden the ascribed trait and ask for clarification. So tactic 5 can work well when someone is generalizing a negative trait to, those people. Instead of arguing about the group, we universalize the behavior, right? If someone says, "Oh, this group of tenants are always so loud," right? I think you'll find response could be, I think you'll find loud and quiet people in every group, right? Universalizing what they're saying. And people on housing vouchers are all irresponsible, right? I've seen responsible and irresponsible tenants at every income level, right? Universalizing the ascribed trait. Um, so that leads to tactic 6, and that's really asking for clarification. Instead of immediately labeling the comment, we throw it back, right? We kind of like throw it back. Can you tell me more about what you mean, right? Do you really believe that XYZ people are unsafe to be around? What experience, leads you to that conclusion about so and so, right? Really like questioning, asking for clarification. It forces that person to slow down, to think what they're saying, and it communicates that you're not just going along with what is being stated, implied, or directly stated. It can hopefully open the door to a deeper dialogue, and can be very powerful, right? Asking a clarifying question unmasks what's underneath without, immediately escalating. Again, this is all strategy 1, making invisible visible. And the last 2 tactics are make the meta message explicit and reverse, redirect, or mimic. So according to Sue, tactic 7 is more direct and higher risk. We make the meta communication explicit by restating it. So that would look like you're saying we shouldn't promote this person because of X, Y, Z, and that makes them less dependable than X, Y, Z, right? We're really using our summarization skills to make that message, that underlying message, very, very explicit. If I'm hearing you correctly, what you're telling me is you're not renting to him because he belongs to this cultural group and you think that other tenants would be better in this apartment, right? It sounds like you're assuming tenants with vouchers don't take care of their units. We are being very explicit here and asking the person to really restate, to clarify what they're saying, to own what they're communicating. And it's not about humiliating them. It's about, removing that protective layer, as Sue and Sue note, of like vagueness that allows that oppressive idea to go unchallenged. And then tactic 8 is reverse, redirect, or mimic. The comment as if it were directed at the speaker. So Sue and colleagues say this is kind of like verbal jujitsu that can use humor or irony to expose a double standard. So that might look like if someone says a compliment, "Oh, you are so good at X," for a person belonging to this group, right? Then the use of this tactic might be, thanks, you're so good at X too, right? We are using that comment back at them to kind of mirror the absurdity of the statement that they made, right? This can be, as Sue and colleagues know, more confrontational, may trigger defensiveness. And so you got to be very mindful of using that tactic. Where are you? Who's present? Who's speaking? That power dynamic, that sense of safety. Sue and Sue note that it might not be safe, and that's why we have different options in our toolkit. I am going to stop share. We are not going to get to our strategic goal, the 7 tactics of disarming. They are included on your worksheet that I'm going to put into the chat. We are going to be doing a second session, I believe in January, where for folks who've attended this session, we're going to do a lot of application of these strategies with some role plays. I was hoping to get to the point where we could go to a breakout group room and have you talk about which strategy you would use in reference to the activities that we did earlier. But some of these disarm strategies look like interrupting and redirecting, right? And so that might look like, stop right there. Those comments are hurtful. I'm not okay with that kind of joke. Let's not go there, right? Really just telling the person, full stop. State values and set limits. So that might look like setting values and limits. Respect matters to me. I'm asking you not to make comments like that, right? This is not a work culture that tolerates those types of comments. Again, this is disarming. Expressing disagreement. Simple statements like, that's not how I view things. That's not how I see it. I don't agree with what you just said. That doesn't sound right to me. I think there's an assumption there that I don't share with you, right? Again, these are all disarming the microaggression. And then we see tactics 4 through 7 for disarming. I'm going to stop and let's pause.